Hello everybody, I'm Greg Stock. I'm the CEO of Thibodaux Regional Health System. It's my pleasure today to introduce Dr. Elizabeth Ansert. Dr. Ansert is highly trained in an area where there's a lot of need in this region where we live. It's a pleasure for us as a hospital system to have her join us. And tell us first though, where did you grow up?
I grew up around Louisville, Kentucky. That's kind of where I was born and raised. Moved to Southern Indiana when I was roughly 10, just right across the river.
Good Southern girl.
Yep. Bourbon country, horses, bluegrass, all that good stuff.
I like that. Well, I know you noticed you said Louisville, if I said it quite right.
Yeah.
Close.
You nailed it, yeah.
It's not Louisville.
Or Louisville. Louisville's in Colorado.
That's in Colorado.
That's how you know.
So that's great.
So I went to Indiana University up in Bloomington for my undergrad. I studied biology, psychology, and criminal justice. Spent some time being a police officer up in that area as well.
Wow.
Yeah. And then I wanted to kind of explore the criminal justice aspect of things a little bit more, so I ended up going to New York, to John Jay College of Criminal Justice, and got my master's in forensic psychology and criminal profiling, and then worked as a psychological therapist for about a year and a half or so, working with kids and adults, and especially in the Department of Child Services, and trying to reunite families and things like that. But it wasn't, when you're doing something and it's not really your calling, So I felt that, and I was like, what else can I explore? What did I want to do? And that's how I found podiatry. And then I ended up going down to Barry University in Miami for my podiatric degree. Then I went up to Massachusetts for my training for residency, stayed up there for 3 years, and then I went to Dallas, University of Texas Southwestern, for my fellowship.
That's an interesting background. Both the education and the experience you had. That's got to be valuable in life experience and being a doctor and being able to talk to people and communicate with them.
Yeah. Well, especially when people are, having pain or they have an issue going on, it's pretty scary. And so to be able to understand not just medically what's going on, but also to understand kind of where they're at mentally and being able to maybe even help with some of that, I think is, hopefully helpful to the patients.
Yeah, beyond just a real narrow piece of what you do. So you went to Dallas and you did some training there. We'd call it a fellowship, right?
Correct.
Tell us more about what that entailed and your interest there and how it's prepared you to do what you'll be doing in this area.
Absolutely. So it was in diabetic limb salvage. I specialized in everything foot and ankle that had to do with that. So a lot of diabetic care, lots of infections, lots of biomechanical things that would lead to ulcerations, and ultimately to prevent any sort of amputation in the lower limb and to hopefully save the limb and save lives and things like that. So
yeah, there's a lot of people in our area that have diabetes. It's well known, diabetes belt. And there's a real need in this region for this service. But limb salvage, you kind of hit on it, but what is it? Let's just talk about it for a minute.
Yeah, so limb salvage is a very simple way of putting something that's very complex. So you're looking at, especially with diabetics, their immune system is compromised, their skin is compromised, nerves, vessels, all these things are compromised just from their systemic disease. So that makes it harder for them to feel if there's a problem, to understand kind of what's going on, and then it also changes the structure of their foot and how their foot functions throughout their day. So sometimes people will get ulcers, or they'll need special shoes, or various other things like that. If, say, unfortunately, they get a cut or something, it's harder for them to heal it. So it's a lot of components kind of coming into one thing. It may seem just like, oh, I have a little cut on my toe where I went to cut my toenails and I clipped a little bit of my skin or something, but that can turn into a really big issue. So it's not only dealing with an immediate issue that could potentially lead to an amputation and trying to prevent that, but also trying to prevent those issues from even starting.
Great.
So it's a very holistic problem that we're trying to deal with, from shoe gear, preventative care, infection control, addressing any sort of deformities that may be in the foot. It's kind of a very big spectrum that has to deal with everything in the lower limb.
Yeah, it's complicated stuff, really.
It is, yeah.
Yeah. So these underlying diseases that affect people's health, their ability to function, walk in this case, and without assistance and all of that, getting upstream, I call it, on the problem and trying to prevent and even diminish the problem when it's there is a huge service, great service to the people in this region. And Dr. Ansert, Elizabeth Ansert, we welcome you to our medical staff and to our facilities here.
I appreciate it. It's so nice to be here.